To meet Mr. Lee. My name's Dr. Ahmed. I'm one of the doctors here in clinic, and I'll be seeing you today if that's okay.
That's fine.
What I'd like to start by doing is asking you a couple of questions. Firstly, could you tell me what's brought you here today?
Because of my lack of breathing when I climb stairs.
Okay.
I'm all right when I sit down in a chair, but when I have to exert myself, then I lose my breath. I have to sit down in a chair till I get my breath back. That is the problem.
When did you first notice this problem?
It's gone on for about 2 years. I've seen different doctors about the condition that I've got, and it is what's led me here today.
Okay. Have you noticed over the last 2 years that your breathing is getting better, worse, or is much the same?
It's getting worse.
Okay. If you were to go for a walk, could you tell me how far you'd manage before you'd have to stop?
About 10 yards, and then I'd stop and then start again.
Okay. And do you get short of breath going up a flight of stairs?
Definitely yes.
Okay. Do you get short of breath speaking?
No.
Okay. With your shortness of breath, have you noticed any other symptoms, such as a cough?
I do have a cough occasionally. If I'm not careful and I catch a cold, I'm coughing then.
And is it a dry cough, or do you cough things up?
No, it's a dry cough.
Okay. Do you have any pains in your chest?
None at all.
Okay. No pains when you take a deep breath in?
None at all.
Okay. Have you noticed any other symptoms in association with your shortness of breath, such as fevers or weight loss?
No, none at all.
And any tiredness?
I can doze off, but I put that down to my age,
Okay.
being 75.
Do you ever feel wheezy?
No.
Is your breathing worse at night at all?
No, I'm all right when I'm laying down, and I'm all right in sitting in a chair. It's when I exert myself, that's when it comes on.
So lying flat at night doesn't make you short of breath?
No.
And have you noticed whether or not your ankles swell?
I haven't noticed that at all.
Okay. Do you mind if I ask you a couple of questions?
Certainly.
Apart from your breathing problems, do you have any other significant illnesses?
No. I've had 2 operations.
Okay.
I've had a laminectomy, and I've had a skin cancer taken off the side of my nose.
Okay. Are you on any regular medications?
Yes.
Okay.
I'm on butamide, and I'm on a blood pressure tablet as well.
Okay.
And I'm also on Solpadol because of my back operation I had in 77.
Do you take inhalers?
No, I don't.
Do you use steroids at all?
Yes, I use steroids. I was on 3 a day. I'm now on 2 a day.
Okay. And have you noticed that the steroids have made an improvement with your breathing?
I haven't noticed any noticeable effect at all.
Okay. Can I ask a couple more questions, just
Sure.
more specific to what you used to do? What did you used to work as before you retired?
A long-distance lorry driver?
Okay. Have you ever worked in the shipping industry?
No.
Ever worked with asbestos?
No.
Okay. Do you keep pets or birds at
No.
home? Okay. And do you smoke at all?
No.
Have you ever smoked?
No.
Right. Any illnesses in the family?
Not that I know of.
Okay. All right, thank you, Mr. Lee. I've finished asking you some questions now. What I'd like to do next is examine you, if that's all right.
That's fine,
Okay.
thank you.
Can I start by having a look at your hands, please? Just looking at your hands. Can I ask you to put these fingers together like that? All right. Okay, thank you. You can sit down, it's fine.
Oh.
Sorry. Just pop your hands out like that and cock your wrist back for me. Okay, thank you. That's lovely. I'm just going to have a look at your eyes. Can you look up for me? And down. Just going to look at your lips. Thank you. And a feel of your neck. Okay. Just going to examine your chest now quickly, if that's okay.
You want me to undo it?
Please. Okay, take a breath in for me, Mr. Lee. And out. And in again. And out. And once more in. And out. And in again. That's fine, thank you. Okay. Just going to have a quick feel. Just going to have a listen to your chest. Breathe in and out. Just keep your mouth open and keep breathing. And out. And again. And out. And again. And out. Once more. And out. And again. And out. And if you can sit forward for me. I'd ordinarily examine the back of the chest fully also, assessing for percussion and expansion, but due to the lack of time, I'm just going to have a listen. Deep breaths in and out through your mouth, please, Mr. Lee.
Okay, you have 2 minutes remaining.
Thank you. Okay, Mr. Lee, I've finished examining you and asking you questions now, but before I go on to explain what we're going to do next, have you got any questions that you'd like to ask or any concerns?
Well, I'm concerned about my breathing. It doesn't affect me when I'm sitting here or watching television or doing anything which I don't have to exert myself. But when I exert myself, then I'm gasping for air, and I'd like to know what the problem is.
Okay. So I think what we should do really is try and establish the cause of the problem. And to do that, what I'd like to do is some more tests. Firstly, I'd like to take some blood tests from you today. I'd like to do a test of your breathing, some lung function tests and a chest x-ray. And then depending on that, we might need to do some further investigations and some scans of your chest as well. Okay. Would that be all right?
That would be fine.
Okay. Thank you.
As long as we can get to the bottom of it.
Nice to meet you, and I'll see you shortly with the results.
Thank you very much.
Okay.
What are your findings and what is the possible diagnosis for this patient?
This is an elderly gentleman whose main complaint is that of shortness of breath on exertion. Positive clinical findings were that he had evidence of clubbing of the fingers, and that was quite marked. Together with this, he had bilateral fine end inspiratory crepitations from the mid-zones down to the bases posteriorly, and also in the axillae. In summary, this is a gentleman who I think has got pulmonary fibrosis. Causes of pulmonary fibrosis affecting the lower zones are in particularly connective tissue diseases, occupational lung disease, and drugs as a cause.
And what are the other possible causes for pulmonary fibrosis?
Other causes of pulmonary fibrosis include idiopathic pulmonary fibrosis, extrinsic allergic alveolitis. Also, conditions that can affect the upper zones include TB, ankylosing spondylitis, rheumatoid lung disease, and sarcoid, as well as radiation fibrosis. The PACES examination is much like doing a driving test. It's important that you make manoeuvres and movements obvious. When looking for clubbing, make it obvious that you've seen clubbing and that you're identifying it. Get down to the patient's level and look for it. It's not important to examine the full respiratory system, as in this case we just examined in particular the bases of the lungs and mentioned any salient features that we would otherwise examine.